Hello, good afternoon, and welcome to the Real Talk Show, a show where we talk about nothing but something that really affects us as young people and the community at large. Well, today we are discussing a very important topic that affects us as young people and the community at large. And the topic that we're discussing today is major barriers to health services for adolescents. So this is a topic that we think maybe we should have a conversation about and just hear from our guests and the audience that's watching on our Facebook page and our YouTube channel, equally on LinkedIn. If you have any questions, you want to interact or anything, the comment section is ready for you. You can just help us by just contributing towards the show. So we are still this discussion is part of the consent to access campaign, and this campaign is supported by HIVOS through the regional sexual and reproductive health rights fund, and the campaign advocates for better laws and policies regarding the age of consent for your adolescents and young people and their sexual and reproductive health services such as HIV testing, contraceptives, counseling, and just accurate information. So most of the times you get to find that many young people, struggle to access health services because of the barriers like lack of information, fear of judgment, stigma, unfriendly services, or maybe even the age itself. So that's why today we have a number of people, like if you've seen on the screen, we have Kristen Peary, who is the program manager at Eastern Region, and we also have Mr. Patrick, who is an adolescent focal point person from Livuyu Urban Health Center. Of course, they are going to introduce themselves. And we also have Mr. Ntoka. Let me not forget to introduce him. We also have Mr. Ntoka, Enoch Ntoka, our senior programs officer at TYD. He's also here to just have a few words and just help us understand the topic. So I will allow my guests to, in as much as I have like introduced you, but I would like you to just tell us your name and where you're coming from and the position that you hold, and then we can get right into our discussion. So I will start with ladies first. I will go with Kristen. Kristen, you can go ahead.
Thank you very much. So my name is Christy Fury. I'm the programs manager for Eastern Visionary Youth and also the project officer for the project called Building Resilience for Youth SR8 and Climate Justice in the SR region.
Thank you so much, Kristen, for that introduction. Mr. Ntoka is going to be the last question, obviously, due to some reasons, but I will go next to Patrick. Patrick, you can go ahead and introduce yourself.
Yeah. Thank you very much. Good afternoon, everyone. My name is Patrick Chisala. My professional background is I'm a psychosocial counselor, a mental health therapist, and I'm an adolescent focal point person that is Livuyu Urban Center here in Southern Province, Livingstone. Thank you.
Thank you so much, Patrick. Mr. Ntoka, you can go ahead.
Thank you so much, Margaret, for this great show. My name is Enoch Ntoka, working as a senior programs officer at the Youth Platform 360, based in Choma, Zambia. Thank you.
All right, thank you so much for those introductions. So, to our audience, the online community watching this show right now, tell a friend to tell a friend so that we can all come here and learn together. We have Christine and we have Patrick, who these people are going to help us just understand what exactly we're talking about today. And getting into the discussion, remember I mentioned to say today we are looking at the major barriers to health services for adolescents and young people? What are the major barriers that you as a young person has faced, or maybe you've just heard about it? People have spoken about it, like the barriers or the challenges they faced when it came to just accessing these services. Well, this is the right platform for you to just tell us and ask questions because our guests are here and they are going to help us at the end of the day. So my first question is going to Patrick. So, Patrick, looking at the topic of discussion today, I would like you to just help us understand what adolescent health services are and why they are important to young people.
Well, thank you very much, Margaret. So tackling the issue, that answer, as in what are these services that adolescents normally come to access, and what are they? I should believe and trust they are not very different from the services that other adults come to access, except when it comes to adolescents, there is just a way they are handled because of the age and because of the behaviors that we normally actually encounter when it comes to adolescents. So they are not very different from services that we offer to the adults, except there's just a special way that we offer to them because of the age and because of the behaviors that they actually portray. That makes it different.
Okay. Thank you so much. So you've mentioned to say these are services that you offer to young people, and of course they are not different from other services that you get to offer to other young people. So when we talk about those services, what kind of services are they that young people access, and the services that um, other people just access, like maybe the older generation and whatnot? What services are they? Like the specific services that you offer at um, Livuyu Urban Center.
Thank you very much. So we offer one of the services that we offer is SRHR, that is sexual and reproductive health rights. And in this sexual, reproductive, and health rights, it encompasses a lot of topics. We'll talk about rights and educations concerning the adolescents, also family planning, teenage pregnancy sensitizations, STIs, HIV, gender-based violence, drug and alcohol abuse. This time around, we actually call it substance abuse. So just to mention a few, these are the services that we actually offer to the adolescents. And we've packaged them in a manner that we are looking into them as a serious thing because we've actually encountered a lot of numbers when it comes to HIV, escalating of the numbers of HIV in terms of adolescents having new infections, STIs, teenage pregnancies. So these are the ones that we offer that are found at our facility. Among the others that are general, like maybe malaria, we offer these other services, like I said, but these are packaged in a manner that we look unto them in a special way.
Okay. All right. Thank you. Thank you so much for that response, Mr. Patrick. So I'm going to move to Madam Christine. Obviously, Madam Christine is coming from an organization point of view, and they deal with young people. And obviously, you had some issues where young people were just able to express themselves and talk about certain issues that they get to face as they try to just access these services that we're talking about today. So, Madam Christine, from your work with young people, how serious is it when it comes to the problem of lack of information about health services?
Thank you very much, Margaret. So, lack of information is still a very serious problem in the communities, in as much as a lot of organizations, a lot of services are being offered when it comes to SRH, lack of information is still a major barrier when it comes to accessing the SRH services. So our organization works mostly in the community, in the rural community, and we have seen and observed that a lot of young people have no information when it comes to accessing sexual and reproductive health. This is more because of traditional barriers that are there. You know, traditions have got their own rules as well. It states what and what not a young person, what he or she can do and what they cannot do. And also, they are still confined in their own spaces instead of being found in other spaces that other young people are found. So you're going to find that most of the times, very few adolescents, mostly those that are surrounding maybe a certain health facility that deals with SRH services, are the ones that are going to have a little information about SRH services. And some of them may have the information, but mostly wrong information. There are a lot of misconceptions. You're going to find that someone would say, no, I cannot access the services because I may not give birth in future. So lack of information is still a very big challenge out there.
Great. So you've mentioned to say lack of information, especially you, who is coming from a perspective of an advocacy organization, where you're trying by all means to at least give information to these young people so that they don't get those myths and misconceptions around accessing these services and whatnot. So, as an organization, what is it that you're doing to just ensure that at least you are bridging the gap, which is there when it comes to young people just having the accurate information on these services, and how best are you educating them to say, mindset is something that is very, very difficult, I should say, to deal with, especially when young people, we as young people, we've said to say this is how it is, and we believe to say this is how it is, but then at the moment we get to believe wrong information. So as an organization, what is it that you're doing to just ensure that young people's minds can switch from what they know to something that is actually accurate?
Thank you very much for that question. So, as Eastern Visionary Youth, especially in the SRH project that we've been running for the past 2 years, this is the third year. So, we have started by training the adolescents themselves as peer educators. We have worked closely with the health facilities to select some adolescents who were trained to work as peer educators in order to educate others. You know, we always say peer-to-peer education is better than adult to a young person. They may feel constrained or maybe feel shy to get some information, but getting information from your fellow maybe adolescent or fellow adult is quite better. So we started by training the adolescents to work as peer educators, and these trained peer educators went ahead to form the community clubs in their communities so that when they are meeting as an adolescent group, they are able to share information and also even organize programs to reach even other areas where they don't have maybe trained adolescents or maybe health facilities, so that the information can still go on even to the places that are not, that do not have those services. So currently, this is what the organization is doing, working through the adolescents, and also as an organization itself, we are carrying out the sensitizations program in the communities in the targeted district that we are working with. That is Chipangali, Chipata, and Kasenengwa in Eastern Province. And also, we are having some radio programs to continue sensitizing. Radio goes beyond the borders, it goes beyond where we cannot reach physically. So radio programs are also part of an awareness tool that we are using, and even social media. Yeah, as Eastern Visionaries, we have a Facebook page, a website, LinkedIn, almost on all the social media platforms to ensure that information is still disseminated, and the information has to be correct so that we don't also mislead people. And to have that correct information, we are working closely with the experts in health and also sexual reproductive health to ensure that everything we get to give correct information out there.
Okay.
Thank you.
Thank you so much for the great works that you're doing just to ensure that young people have this information that they need at the end of the day. So looking at so the other day we had a poll on our Facebook page where young people we were asking young people like what are the major barriers that just prevents them from accessing these health services from health facilities. And at the look of things, we get to find that a number of young people were saying there's lack of information, just as mentioned earlier by Christian. There's lack of information. They don't have accurate information about how they can access the services. Others were saying because of the unfriendly health personnel. This has to do with Mr. Patrick. Mr. Patrick, you're not friendly. I'm just joking. And then we also had other answers where young people were just were saying it's because of age. But then when you look at most of the answers that we got, young people were just there and they were able to express themselves to say, we do have young people as young as 12 years and they're sexually active. But then they are just unable to access these services from the health facility. Why? Because maybe of age, because of the discrimination they might get there, and maybe they just don't have information that they can actually access these services from these health facilities. So now this now takes me back to Mr. Patrick. Mr. Patrick, you are friendly. I was just joking. I was just joking that you're not friendly. You are friendly. So, Mr. Patrick, Christine has mentioned some of the ways they use, like the methods they use to just give information to these young people on how exactly they can access these services. You being someone who deals with young people, of course, you are the adolescent health focal point person, and you get to deal with a number of young people, especially when they come to access such services. But how best do we do it? Do you do it to ensure that young people have the right information on how they can access these services?
Oh, thank you very much, Margaret. Um, just to add up with what my colleague is from saying, so we have got a lot of ways in how we best disseminate the information. Not only do we disseminate the information, but also make finding ways in order for us to reach on the adolescents, because we've come to understand that it's not all of them that may come to the facility due to different kind of barriers, and one of them is fear of unknown, and they are scared of what they do not know, maybe sometimes the results. So what we've done is we've strategically enrolled a lot of adolescents from different circles, because when we talk about adolescents, we've got adolescents that come from the school, specifically they're in school, and they can only be reached in school. We have those that are in the community, they can only be reached in the community, they don't go to school. We have also those that are in churches, and we also have those that are based at the facility. So we've tried our level best to train as many peer educators as we can, and through also the help of different stakeholders like the TYP themselves, training a lot of peers. It has really helped us that they actually reach to most of the adolescents. I think we do a lot of sensitizations in the community, in the schools, and this time around, with the help of the TYP, we are able to now reach the institutions, the colleges, the universities, which has not been happening. I think we're seeing this, I would say, for the first time on a larger capacity, because we have programs that are running just within the TYP that we are going into the universities. I think this is how we best reach to them, to follow them and to follow them through their colleagues who are the peer educators, and to recruit them at the facility. Each and every time when we go to the school, we do the sensitization. We make sure to reach to them about what is happening actually at the facility, and we are having a bigger number, a larger number as compared to before. This is how best we are reaching onto them, and through, of course, not forgetting the youth friendly space. You discover that when adolescents come to the facility, they may not go direct to the place where they are supposed to get help, but they will come through the youth friendly space. We've made it possible and make sure that the youth friendly space has got the peers that are able to manage their colleagues and their friends, and it's really helping in that way, and we respect the friendly space. Thank you.
Great. Thank you so much for that explanation, Mr. Patrick. And we appreciate that you actually welcome these young people and you just help by giving them information through the peer educators that you have and whatnot. I feel like I have spoken enough and a lot. It's time to hear from our Facebook viewers. If you have anything that you'd want us to read to our guests here, if you have any questions, and I've seen the number of you are saying you are watching from Zim, you are watching from Kitwe, from Ndola, wherever you're watching us from, but we also need you to ask the questions. Like, you are the people who are making noise in these healthy facilities in our communities. You're like, I went there, they did this, they didn't do this, but then you are here and you're quiet. So I want you to hear from you. So before we continue with our conversation with Christine and Patrick, and obviously Mr. Ntoka, I have a comment here that is coming from this is Palisa. And Palisa says, I think some of the other barriers to health services for adolescents are firstly lack of knowledge and information. Many adolescents do not have enough information about available health services or about their own needs because of limited health education. They may not understand issues related to sexual and reproductive health, mental health, or disease prevention. Secondly, stigma and fear of judgment. Adolescents often fear being judged by health workers, parents, or even the community members. Thank you so much for that comment. Just as I mentioned earlier, Mr. Patrick is friendly. Should visit Mr. Patrick. Mr. Patrick is friendly and is going to welcome you. And looking at stigma and just how young people get to bring it about. Like, we had a number of young people just spoke about it to say there's so much stigma in these health facilities and whatnot. Mr. Patrick, you deal with young people, and obviously you get to meet them on a regular basis. Have you ever had cases where young people just come to you and they say to say, I can't access such services because of maybe what I'm going through, or maybe how do you handle such young people unable to access services because they feel like you're going to judge them at the end of the day?
Thank you very much, Margaret. A lot of times I've encountered such cases where adolescents will come to me. Sometimes it may not be at the facility because they have actually seen me most times visiting the community and going to the schools. So they will try by all means to sneak out from their colleagues and come to tell me, I want this, but I feel I cannot come because I'm scared. I don't want this sister to see me, more especially those that have got relatives who are health workers. So we try our possible means to help them according to how they would want to be helped. As we all know, we don't just advise, but rather we render help. We need to meet halfway. How do you want to be helped? Then, do you want me to help you, or do you want your colleague to help you? Sometimes they will choose you because of how maybe you've been interacting. Sometimes they would want to choose their age group. So countless time have I actually encountered such, but we still have a way to help them. We've been told an adolescent or any other person should not go back without receiving the service wherever you meet them. When you meet them in the community, they can call you. Make sure that they don't go back without receiving the service. What kind of a service? Tell them where they're supposed to get the service, If you cannot come to the actual place, the OPD or any other in the youth friendly space, actually this time around, there are provisions where you are going to find the vitals in the youth friendly space. This is how good the Ministry of Health is actually, putting things in place in order for the adolescents' needs to be met. Thank you very much. Just to respond to that, Margaret.
Thank you so very much. And one thing you're forgetting, Mr. Patrick, you're forgetting something as you're starting to say. You know, we as young people, we get to think like you health. So if I meet one health personnel like a nurse, I'm going to access the services, and I meet this person for the first time, and they give me that kind of an attitude. I'm going to go with it and say, health personnel are very judgmental when you go as a young person you want to access the services. So for you as you are speaking here, one thing that I need you to be starting with, just as we start in a debate, when we're doing debate in a preamble, we get to have those words that we say. So even you as you are speaking now, I would like you to be saying, please, as you are listening to this, as you are watching this, you should know that we are not judgmental, and I'm not part of the judgmental people that you get to find just to clear your name, because I mean we all see you as being judgmental. Anyways, before we go further, Madam Christine, you're welcome. Before we go further, I know our viewers on Facebook, you are eager to ask those questions and just tell us where you're watching from. You can still keep the comments coming and we'll be able to read them just here. And these people are here to actually just respond to some of the messages that we have. So I have a comment here from McLean. Masculine, I don't know, but okay, the last name is in Nwe at least. So this person is saying, can a suggestion box be effective for someone who would want a certain services to be provided in a clinic but cannot approach them directly? This, I think this one goes to Mr. Patrick. Mr. Patrick will be able to respond to this, but before we go into this, before Mr. Patrick responds to this, Mr. Patrick, I hope you've taken note of the question, which is, can a suggestion box be effective for someone who wants to access the services from the health facility, but then they can't just approach you directly? Is that workable? Mr. Patrick, you can go ahead, and then from there, we can have Mr. Ntoka say something. He has been quiet on this show for some time now.
Okay, we've taken note of that concerning the suggestion box. I think we do have suggestion boxes in different facilities. Yeah, we do have the suggestion boxes, and we'll be able to maybe work on how best we uh, conduct just by viewing what has been put in the suggestion box. Maybe giving the feedback or the responses is maybe where the communication is not well done. Maybe we need to work on that. Thank you, taken note, and we will try by means to work out that one.
Thank you. All right, thank you so much, Mr. Patrick. So, as young people, this. I think this goes to other health facilities that are dealing with young people. If you find that this is going to be helpful, especially for those with kid-friendly spaces, you can just come up with a suggestion box where people can be throwing in their concerns, and at the end of the day, you just get to improve in terms of how services are going to be provided for you. Mr. Ntoka, you can go ahead. I'm so sorry for keeping you this quiet.
No, there's no problem. Actually, I'm learning a lot. This show is packed with a lot of information coming from the Mr. Patrick, especially his experience as far as interaction with the adolescents from the service point is concerned. I think it's very much enriching to hear somebody that is on the ground speak to how they are providing services and just the pertinent issues around the service provision. I think one of the issues that caught my attention is when he was explaining about the fact that the services adolescents and young people accessing the healthcare centers are not very different from those services that are accessed by the other general population. I think that is also insightful But I do also know that the different populations in as far as services are concerned are affected differently, and the access to these services are differently. So because of the unique situations that different populations find themselves, especially the young people and the adolescents, I think there have been efforts, just like Mr. Patrick has mentioned, there have been efforts that have been made by the Ministry of Health and also partners like TYP to try and meet the unique needs of those adolescents and young people, just to ensure that they access the services without barriers. One of the challenges that I keep seeing is that the setup of healthcare health facilities in Zambia is in such a way that they are placed right in the communities where the people live, or next or near to where people live. So because of that, you find that even the healthcare providers live within the people, okay, within those particular spheres where the beneficiaries live. So it's almost likely that a young person going into a particular facility, they are more likely to find a healthcare provider who is a friend to their neighbor, their relative, and because the community is interconnected like that. And that's the reason why Mr. Patrick spoke to the fact that, or is it you, Margaret, that spoke to the fact that sometimes when they go to these facilities, they find the people that they know, and because they find this particular person, they may just go back without accessing the service that they wanted. And before you know it, word will go around that among all the young people in the community, that there's A, B, C, D, or provider this and that works at a facility, and all of them that may have interaction with that information may not actually access the services. So that is one of the challenges. But I know that there are interventions that have been done. One of them, like Mr. Patrick said, outreach services, where we identify spots where young people can come and access the services outside of the mainstream uh, clinic or health center or hospital where they may not be comfortable. There are also at times when these particular services are provided on one-to-one, depending on the kind of service. All those are unique interventions that have been created to ensure that these services are accessed by young people. There are enormous challenges. Some of them you'd be very surprised that young people are not actually just comfortable with the smell of a condom, for instance. So if they know that for a particular clinic has got a type of a condom that smells bad, they will not actually be able to come to that facility and pick that condom. But within the condom provision also, you find that it's not easy for a young person or indeed any other person in the community to navigate a particular facility and pick the condom, because most of these condoms are placed sometimes in areas where young people cannot navigate and access, like in departments where the mothers access the services, and sometimes in outpatient departments where you find a lot of people and young people are not able to access those. So I know also that there have been interventions to make sure that these condoms are made available in places where they can access them, except that in some cases you find these condoms are abused by the very young people sometimes. So when they're supposed to get 10, they will get 100. And we are not sure how the 100 will be distributed out there. So there's some level of abuse sometimes of these particular commodities that are accessed by young people. I think for now, Margaret, I have a lot to say, a lot of comments based on the information that has come forth. Let me just allow the others to just come in as we enrich the discussion. Thank you for giving me the time to add a word to the discussion.
All right, you're welcome, Mr. Ntoka. Thank you so much for your contribution. You are definitely paying attention, even though you are not responding to anything or what. But it's good that you are paying attention to the information being given and you are able to give feedback. Thank you so much. Mr. Patrick was I don't was feeling shy and had to turn off his camera for some time because we're talking about him. But anyways, you're welcome back. We are happy to see your face. I'm going to go to Madam Christine. So we've spoken about the stigma that goes around in. Oh no, Madam Christine has just dropped when I just mentioned her name. Okay, she's here. So
No, I'm here. I'm here.
okay, okay, good that you are here. So looking at the stigma that's around young people just getting information from different health facilities, and of course we've spoken to Mr. Patrick. He has showed us some of the things that they get to face as health providers and whatnot. So, looking at the stigma and the lack of information that we've spoken about, Madam Christian, what do you think could be a major problem that's making young people not really to just uh, still, even though the information is being given, like Mr. Patrick has mentioned, information is being given through the peer educators, and you equally have the peer educators. But what do you think would be the major barrier that is making young people to just stay like Tatuishiwe? We don't know what is happening and we don't know how to access the services. What do you think would be the problem?
Thank you very much for that wonderful question. So there are a lot of challenges as into why young people are still having this some misinformation, and maybe they are not even willing to participate in some of these activities. One of the major challenge I would say is age when it comes to the age of consent. So for we know that for Zambia, a young person who is 16 years and above can access the services. But those that are below 16 years, they cannot access the services, and even the information itself, they are not allowed to have such kind of information. So you find that when, as an organization, when we are having community dialogues, sessions, parents themselves will even testify to say in this area, children start engaging in sexual activities at as early as 10 years old, and they may want maybe to protect themselves, but for them to go and access these services, they can't because they're not at that age of accessing the services. And who do they even ask? You know, it is stated that maybe a parent or a guardian can escort that particular child to go and access the services. But you know, this is Zambia and this is Africa. Which parent in the world will go and escort a 10-year-old child to go and get condoms at the facility? That is a taboo. So age is also a major, or let me say, a big barrier to young people not accessing the SRH services. And also sometimes on the traditional part, there are also some still those kind of traditions or customs or rules that are put in place when it comes to young people taking part in some activities. So it is also a major barrier. And also on the same tradition, they also have some activities that even contribute to young people engaging into sexual activities. But at the same time, having also some traditions that limit the young people into accessing the services. So it is also kind of a challenge. And you know, when a traditional leader speak in Zambia, we've got chiefs and kings. When a chief speak, no one can even argue. So when the rule comes from the top, it is final. So these are kind of some major challenges that young people are facing, and also sometimes maybe they are not being engaged. Others, like we said earlier, that they don't have information, they don't even know where do I get such kind of an information. So there are some also areas maybe they are not even reached by organizations or even health facilities. So they don't know, like completely, they don't have any information about SRH. So they're just doing things because they have to do it. And during one of our community meetings, one young person confessed in a group of people with parents around. He said, in as much as you may say we should abstain, it is not possible because we have feelings. And we cannot stop their feelings. They really need to be accessing these services. Information is key, and also the extra services, as Mr. Patrick said, the contraceptives, condoms, and the like. They need these services, but what do? They can't, because they have those restrictions of not having that chance to access the services. Thank you.
Yeah, thank you so much. You've mentioned something really interesting when it comes to parents and young people. Obviously, yes, these are young people who are able to express themselves like this is something that is happening. And of course, maybe some of us, we know that yes, it's a normal thing that a person gets to go through certain things, but then they just, I feel like they don't get to have the space or the place where exactly to express themselves, where they can be heard. And then when it comes to parents, yes, quite all right. No parent would allow a 12-year-old to go and access contraceptives at the health facility or whatnot. But then, Kristen, this is now a question to you. You've mentioned most of the challenges and the barriers that really just makes it so difficult for young people to access these services, of which we are talking about the age of consent here, and we are also talking about parents not really being in support of their children to be accessing these contraceptives, and obviously just young people being there to express themselves on certain issues that they get to face and how they can be helped at the end of the day. So when we look at parents, obviously these young people also come from schools, and others get to come from different organizations. So Christian, what is it that organizations, parents, and just schools in general can do to just ensure that young people they're just there and they can have the right information and the access to these services can improve?
Okay, thank you very much. So I feel the great key that can help us to, for all of us to be on one page, the parents, other stakeholders, facilities, schools, what we need is collaboration. If we work together, everything is going to go smooth, because we are going to have one mind, we are going to have one language to speak. Rather than, we know that even in our schools in Zambia, a young person is not allowed to have SRH services. Even when a child goes to the facility to access services in school uniform, they are sent back because they are in a uniform. But when maybe they go not in a uniform, they are going to access. So if we can work together, if we can collaborate and have one strong language, including traditional leaders, also they need to be part of this collaboration, because they are the most people that makes the rules. And if we collaborate, I believe and trust that things can change, because you're going to be speaking the same language. Thank you.
All right, thank you so much. So Christian says we need to have the same goal. Like we need to work on something which is similar in order to help adolescents and young people out there. If you are a parent, if you are a young person who's watching this and you'd like maybe your mother to hear this show and just be advised at the end of the day from what Christian has said, you can just share this and they'll be able to listen to this and at least get to help us with information that we want as young people. Well, it seems like we're running out of time and the conversation keeps building up. And I can see that we are all ready and we just want to keep talking. Mr. Patrick there has got so many points to give us. Christine there has something to tell us, but then time is not within us. And if we have the online community, you still have anything that you'd like to add on or to ask on this show, please, the comment section is there for you. You can just help us by commenting and just contributing or just asking questions. We have guests here that will be able to respond to you in a few minutes that we have before we get to wind up. So I'm going to ask, I'm sad to say this, but I just have to say it. But I'm going to ask last questions to each one of you. A last question to Mr. Patrick, and the last question to Christine. And obviously, Mr. Ntok, I'm going to give you seconds for you to just say your last words. I'm not going to ask you a question, but I'm going to give you seconds to just say your last words, and then we're going to wind up from there. So I'm going to start with Christine, since you're the last person who spoke. So it's just going to be something that you're going to, in a few minutes, please, in a few minutes. So, Kristen, you've mentioned to say we need to have the same goal and the same mind as the people, as parents, organizations, and schools, and including chiefs, when it comes to just helping us as young people access the services and obviously have the right to at the end of the day. So I would like you to just tell us what strategies that you've been using as an organization when it comes to helping young people with acquiring the accurate information that they need on the services. And then when you say the strategies that you've been using as an organization, I would also like you to just tell us your last words, a word to the parents, to the schools, to the organizations, and to the organizations, other organizations, and lastly to the young people. You can go ahead, Kristen.
Okay, thank you very much. So, as for the strategies that Eastern Visionary Youth has been using to improve access to SRI services, from the same community clubs that we organize for the adolescents, we have also given some referral forms. We know, like I mentioned earlier, that peer to peer is always better. So we have provided referral forms whereby if a young person needs some services and they're afraid to go to the facility, or maybe they're afraid to face that needs, they know that is rude, or they know that know their mom or dad, they can go through a fellow peer educator to go and get a referral form, and they're going to be escorted to someone like an adolescent focal point person at a clinic whereby they're going to get those services freely. So that is one of the strategies. And through also the very sensitizations meeting that we've been encouraging the use of contraceptives among young people, and even to the parents, because I know it is hard to convince a parent. They would say, no, 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 I cannot allow my child to go and get condoms, because it's like I'm encouraging. But we get to have a discussion, a deep discussion, explain to them the importance. Would they want to have a child bring maybe diseases and pregnancy at home, or maybe let them use contraceptives and have maybe continue school or anything that they are doing. So yeah, have after upon having a better understanding with the parents, at last they usually do agree, and even others escort the children to go and get the contraceptives. So you say they should have some few minutes. As for the youths who are listening or who are viewing, and for the parents, let me start with the youths. For the youths, life is in their hands, and they need to take it upon themselves to ensure that they safeguard it. And this takes us to be part of other groups, because we mentioned that young people do not have maybe much information because they don't want to be involved. So if they are not involved, or they're not part of other groups, yeah, truly they are going to be left out. But be part of your friends, be part of the groups that are going to give you positive change in life. And for the parents, when it comes to SRIH, I know it is something hard for them to accept for their on behalf of their children. But let us look at the future of our children. If we let our daughter or maybe our son to impregnate at that young age, meaning their future is compromised. In as much as they may go back to school after giving birth, it still comes with a lot of challenges for them to balance education and motherhood. It is still something hard. So for the parents, please let us look at the future of our children, and not look at what is happening, as in not looking at now, because you're saying, no, mwana wanga, and I can't do that. So maybe my child cannot do that, but we don't know what they're doing behind our backs. And they will look innocent in our presence, but we don't know what they're doing in reality. So we need, as parents, we need to look at the future of of our children. Let me not take much of the time. Thank you very much.
Thank you so much for that, Christian. Thank you for the information and just telling young people what exactly they need to do and the parents out there. So I'm going to go to Mr. Patrick. Mr. Patrick, you're going to tell us your last words, and please, I want you to emphasize that you are not part of the judgmental health healthy practitioners, but you are friendly to young people. And I want you to tell young people, I want you to assure young people that they can access these services, and how friendly you are when they get to approach you for these services. Please, you can go ahead.
Thank you very much, Margaret. And um, this life has got a lot of sides. There's a good side, there's a bad side, but we always aim to go to a good side. When it comes to us being judgmental, there's an aspect of human being in us that, of course, we don't support being judgmental because we are trained. There are ethics, but we don't condone that. We don't support that. So what now the Ministry of Health has done is Ministry of Health has put up a lot of strategies to train almost all the health workers concerning adolescent health education. Most of them, I think, at our facility, most of them have undergone trainings that has to do with adolescent health care. So this time around, we are moving at a very good pace where each and every health personnel is going to be trained to be handling adolescents. That's number one. Number two, um, adolescents, I always encourage them. And one of our priority as Livuyu facility is to make them to come to be part of the facility, to be the peer educators. We recruit as many adolescents as we can, because one of the things that we tell them to say is when you become a leader, it's difficult for you to mess up. So we believe in so much in recruitment so that they are leaders to others. And also, just I always keep on encouraging them, keep on coming to the facility. When you go to the churches, the information that we give there, they are half, baked. Why? Because it's not everything we can talk about. Same applies to schools. In the community, of course, we can, but it is at the facility where information can be given without limits. Why? Because the condoms that we do not talk about in schools, it can be talked about at the facility. The family planning, which we can't talk about in other institutions that I may not mention, it can be talked about at the facility. Wherever you adolescents are listening, wherever you're hearing me from, please be part of any youth-friendly space nearby your facility. Just also to add on what my colleague has said, as what we do at our facility, adolescents are used to information. They, of course, we need to reach to a lot, but we have also added on the skills. We tell people sex is an activity. An adolescent can be informed about sex, but what will replace that activity is another activity. Us as Livuyu facility, we try our level best to discover a talent within an adolescent to replace the sexual activity. Those that can sing, we put on their own. Those that can do poem, those that do football. So what we need is also to be identifying their potential that is going to replace the activities they do. So come at our facilities. You are going to find something for you, and you are going to know yourself when you come, because we also trust in identity and also self-awareness. These are the last words that I'm saying. Be part of the youth-friendly space. Thank you very much.
Thank you so much. Young people, you have heard I have heard on my end. I'm going to be part of that youth friendly space. It's up to you now to find the nearest health facility. And in Zambia, nearest health facilities, most of them they get to have those youth friendly spaces. Enoch has already unmuted his mic. I'm going to let him speak in seconds. You can go ahead.
Yeah, so my this is an insightful discussion. So my other takeaway is what Christine talked about, that we need concerted efforts. Ultimately, the adolescent belongs to the parents, belongs to the church, belongs to the school, belongs to organization, and they belong to all the sectors of the community. So if all of us as sectors in this particular community are involved, I think we are going to win in terms of ensuring that the health of adolescents is put at the center of healthcare, because the shrubs today are the forest tomorrow. That's what they say in Africa. So very insightful indeed, and I enjoyed being part of it. Yeah, thank you.
Thank you so much. So, to my fellow adolescents out there, just know that today's discussion is really just reminding us that access to these health services is very essential for us as young people, and our well being is very, very important. In as much as we get to say no, these health services that are being offered there, quite all right, they get to help us, but the people we find there, they're very judgmental. They get to judge us, or maybe I might find my mother's friend who might judge me and whatnot and tell my mother about it. We need to remember that our health matters, and seeking these services that are available for us as young people is not um, a sign of anything like you are being you'll be looked at in a different way or something, but it's just a sign of strength and courage that you are able to access them. So I know if we had 2 hours of speaking or just talking, looking at each other on this screen like this and listening to you people online, it could have been nice. But obviously, we need to run now. We're running out of time, and obviously, to the same person who's watching, you obviously have something to do. But wait, before we go, I want to encourage each and every person watching this show to like and follow our Facebook page. Check out our YouTube channel, subscribe so that every time we are having a real talk show like this, you get a notification and you get to participate with us. So, from my end, I think we've spoken enough. It's now time for you to listen and to put the information that you've gained from here into practice. And obviously, Mr. Patrick has told us that he's a friendly health practitioner. He welcomes adolescents. And Christine, thank you so much for just giving us information on the advocacy perspective, like what you do as an organization to just help young people in ensuring that they get the right and accurate information. And Mr. Patrick, equally to you, thank you so much for just being there for the young people, providing services for them and just helping them in accessing these services. To our viewers, I'm not leaving you out. Oh, to Mr. Toka, thank you so much for being part of this show and for your contribution towards the show. We really appreciate. And to our viewers, our Facebook community, thank you for tuning in for today. And remember to also tune in next week as we have another amazing topic with obviously different guests and probably a co-host. And I think from here it's a goodbye. We appreciate you. Thank you.